Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Barbiturates. So first in the barbiturates, the pharmacokinetics of barbiturates. Pharmacokinetics. These barbiturates are actually they are short acting drugs, and in fact they are the ultra short acting drugs. They are highly lipid soluble and they have best effects. They have rapid effects because they are ultra short acting and they have highly lipid soluble drugs, so they have rapid effect, and they are also highly protein bound drugs. So, barbiturates are mainly characterized by two things. These barbiturates can cause amnesia in the patient, and the barbiturates can also, if they are given at longer doses, at higher doses, they can also result in accidental poisoning, or they can also cause poisoning to the patient. So whenever the barbiturates are given to the patient, he undergoes amnesia and he will have automatism. So because of this automatism, he keeps on taking these barbiturate tablets a lot because of the abuse potential which is present in these barbiturates. So thus these will result in accidental poisoning. Why? There is one more issue. This barbiturates leads to amnesia. Whenever the patient has amnesia due to barbiturates, it mainly affects the short term memory only. So when the barbiturates when the patient takes barbiturates, his short term memory is affected. So the patient thinks that he did not take the drug, so he takes the drug again he forgets that he has taken the drug, so he repeatedly takes the drug again and again, forgetting that he had already taken the drug, and as a result this will result in accidental poisoning in the patient. Then the termination of action of barbiturates. The barbiturates action will be terminated by three mechanisms. One, there is redistribution can occur in barbiturates, especially in drug like thiopentone sodium. There is redistribution of the drug occurs. So thiopentone sodium is a highly lipid soluble drug. Because it is highly lipid soluble drug, it goes and distributes to all the parts, all the organs of the body. Especially, it goes and distributes to those organs of the body which have high blood flow. So, as a result, it goes to the brain first, and from there, it goes to all the parts of the body by redistribution. So, as a result, because of this redistribution, the plasma concentration in the blood and also in the brain falls very rapidly. So, thus, the thiopentone sodium is an ultra short acting general anesthetic which is available. Then metabolism. The barbiturates can also undergo metabolism. The barbiturates undergo oxidation by the hepatic CYP450 enzyme. By the hepatic CYP450 enzyme, they undergo metabolism. And the drug phenobarbital is a potent inducer of the CYP enzymes. Phenobarbital is a potent inducer of CYP enzymes. Third mechanism of termination of action is by excretion. So barbiturates can undergo excretion. How? The barbiturates, if on alkalinization of urine, when we do alkalinization of urine, the urine becomes alkaline. So alkalinization of urine will ionize the barbiturates, and thus the barbiturates can be excreted by alkalinization of urine.
thank you and thank you for watching.